We are also joined in by Dr. Marcus and Dr. Raina. They started Meds for More. This is a facility to collect and redistribute unused medicines. Absolutely unique. I want to welcome you two. Thank you very much for joining us. You started this initiative in May. That's about 2 months ago. And you've already collected. Now it's very hard to put medicines in this way, but different medicines weighing up to 125 kilograms, and these were unused, unexpired medicines. Now this is astounding. Can you tell us, how did Meds for More begin?
Thank you very much for having us. And let me begin by sharing that, yes, it is difficult to quantify, but we're probably approaching the 1 metric ton mark now. It's significantly increased since we last spoke. During the first wave of the pandemic, I was a frontline volunteer working in the slums here in the city that I live in, Mumbai. And I got to see firsthand the challenges that this virus had, both in terms of people's lives on their health, but also the livelihood effect in terms of the cost of medicines and the economics of it. And so during this wave of the pandemic, the second wave, as my wife and I were thinking how we could help people, one afternoon, a member of our domestic staff, he called to say his son had been diagnosed with COVID. And he said, "Can I show you the reports?" I said, "Of course, come." And as we were talking about how we may help, I suddenly realized that in the building that we live, I had 3 patients that I had been treating for COVID, and they'd recently come out of their quarantine. So I put a very simple message on our building group asking anyone with any leftover meds to send it to our home. And if it was okay, then we would make it available. And that's how we saw that if one building could come together to help save one life, then just imagine what a locality could do, what a city could do, or now indeed what the country can do for herself.
Well, that's wonderful to hear. This is Amitabh Bachchan. So this is extremely noble. It's a very noble cause that you and your wife are doing and have done. And what a wonderful example you set for the rest of the world and for the rest of the people within India, is to go out and help people.
Dr. Raina, if I can just ask you, from what I've just heard, there's been a exponential expansion in the amount you've collected and distributed. So are you thinking of going into other areas besides Mumbai and going into rural areas and areas where it's more difficult for them to get medicines?
Absolutely. So our mission has been to collect the medicines from big cities like Mumbai. We are now in 10 other cities across India. We started in Mumbai, but we are now actually active in 10 other cities. The idea is to collect the medicines from the cities where we have access, where there is affordability amongst people, and then divert these medicines towards rural areas where there is less access and affordability. So the way that we do this is very simple. We have a website whereby someone can log in and they can choose to either donate medicines or become an ambassador to collect medicines for this particular initiative. And from there, once the collection has happened, we have 4 to 5 collection centers in every city that are a part of Meds for More. And from these collection centers, our medicines go to NGO partners who we have tied up with. And from there, they go to either charitable trusts which service slums, or to primary health centers in the rural areas. And then from there on, they reach the people who need them the most.
Dr. Raina, I just want to ask one
That's
thing.
great.
These medicines that you collect, is there some process that you have which verifies the authenticity of the medicine? And how do you go about it? I mean, you got, kilograms of medicine with you. It must be a very difficult task to be actually looking at them, making sure that they're genuine, making sure that the expiry is not over. This is a management nightmare.
Yeah, sir, absolutely. I never imagined in med school that I would ever be helping set up a platform with reverse logistics and handling something of this type of scale. But what we're really proud of is the fact that, we've achieved this through the great support of so many partners, partners like Uber, who who help with transportation. We've got pharmacy partners, we've got clinic partners, we've got NGO partners. So there are literally thousands of individuals who are involved in this entire process with regard to only donating, number one, unexpired medicines, and number two, unused medicines. You know, we're not asking anyone to go out and buy new medicines. That's not the point at all. And in a country like India, where 45% of the healthcare spend out of pocket is the cost of medicine, where every year nearly 50 million people are pushed below the poverty line because they can't afford their healthcare bills, and where over 500 crores of medicines are wasted. This is an economic benefit. This is a health benefit. It's also an environmental benefit.
We urge people not to go out and buy these medicines. That's a very important part of what our initiative stands for, because it's also about reducing waste and then creating the impact.
So we have to send the medicine to the collection center.
That's
or there is a process where they come and collect it from you? No,
we have that as well. So on the website, if you prefer not to send someone from your home or visit,
right,
we've got the reverse pickup. We've got a coupon code which our partner provides, giving you a discount, so people can have it picked up from their homes as well.
Thank you so much, Dr. Marcus and Dr. Raina, for joining us today.